All right, Dr. Andrew Grecki here. In this video, we're talking about 3 ways to handle a problem. Really, how do we handle hip pain as a problem, right? There's only really 3 things that we can do, and this kind of blends into the number one single biggest mistake that I see that people that are dealing with hip pain make, and I'll get to that in just a minute. So let's talk about it. So how can we handle it? How can we handle hip pain as a problem? Well, the first thing we can do, we can ignore it, right? And I see a lot of people doing that. And when I talk about ignoring it, I don't mean that they're not expressing themselves, they're not thinking about it, they've talked to their spouse, their friends and family about it. They probably even talked to their doctor about it, but they just haven't done anything yet to try to fix it. They're hoping that it's just going to go away, right? If I ignore it, it'll just go away. And I think it's because they get confused about the 2 different types of injuries we talked about earlier, one being an acute trauma that does get better if you ignore it. I break my arm, I put it in a cast, the body heals itself over time. Now, with a cumulative trauma disorder, which is what most hip problems are, if I ignore it, it actually gets worse. So that's not what we want to do, right? The second way that we can alter it, right? We can alter the problem, meaning, and there's so much that you get right now from the healthcare system that alters the issue, right? So we might want to think about pain medications, alters our brain's perception of the pain. Most commonly is anti-inflammatories, which just suppresses the body's natural inflammation, which is actually required to heal. We'll get to that in a minute. Creams, ointments, braces, fancy machines like lasers and ultrasounds and all kinds of braces. And so we unfortunately are given this is the most common treatments we're given. Massage, traditional physical therapy is really good at altering the pain so you just feel warm and fuzzy in the moment and it doesn't provide you long-lasting relief. So we don't want to stay there either, because altering it is really only changing our perception of it. We're putting a Band-Aid on it. We're masking the symptoms, and it's going to get worse. So we've got to change it, right? We've got to change the problem. That's the key. We have to change the problem. And the number one single biggest mistake that I see is people in these first 2 sections. They're either ignoring it or they're altering it. And they're hoping that it's just going to go away. And that's when I see people months, years later when they're really struggling. And it's like, man, I wish you would have figured this out. When we are altering symptoms in the musculoskeletal system, we're doing it usually with taking a drug, right? So we're affecting the biochemistry system. Well, you can't treat the biomechanical system, the movement system, by altering the biochemistry. It just doesn't work that way, And so let me show you this here. This is most people, again, anti-inflammatories being the number one thing that people will take, whether that's orally or through an injection into the hip. That there's a problem with that, because you're altering the symptoms, but you're also delaying the healing process. So all hip pain, by the way, has this in common. There's a level of inflammation that's occurring. And if we back up and say, well, what the heck is inflammation? And if you look at this is called the 4 phases to the healing. This happens to any type of tissue damage in the body. It goes through 4 simple processes. Number 2 being the inflammation stage. That's normal. It's natural. We have to have it. If we don't go through the inflammation phase, we will not progress the healing. So by taking anti-inflammatories, we are suppressing that healing. If you were to have surgery now, the surgeon will tell you 2 weeks prior to surgery, don't take anti-inflammatories, and up to 6 months after surgery, don't take them, because it will delay the healing process, right, from the surgery. Yet we do that as one of our first lines of defense when we're having pain. Doesn't make a whole lot of sense. So we want to try to not alter it. Inflammation is important. It's the 2nd phase of the healing process. We need it. And so again, try not to make the most common mistake. Don't ignore it. Don't alter it. Let's move on and talk about how we're actually going to identify the problems and then that are causing the symptoms, and then let's get to the root dysfunction.